Hey guys, welcome to SourceFED. I'm Joe Beretta.
And I'm William Haynes.
Ebola outbreak update.
Fun times.
But not. As of now, there have been over 1,800 reported cases of the deadly virus and over 960 deaths.
And while West African care centers that were never equipped to handle an outbreak in the first place struggled to contain the virus, one of many questions plagued curious minds the mostest.
Where the HE double upside down reverse sevens did the outbreak start?
And the big winner is Guinea.
It's a competition that you don't want to win. The timeline back to patient zero is actually very heartbreaking, as scientists speculate that patient zero was a very unfortunate 2-year-old boy living in a village in southeast Guinea.
He tragically passed back on December 6th and subsequently passed the Ebola virus on to his mother, his sister, and his grandmother.
And the tiny village in which he lived ended up being a very strategic community in the Ebola war because it resides pretty much on the border of Guinea, Sierra Leone, and Liberia, the 3 nations ravaged by this outbreak.
Attendees of the boy's funeral backpacked the virus back to their communities, and so on and so on.
Like a very horrible version of telephone.
Terribly sad.
So now we're in the midst of the worst outbreak in history, but when I say we're, I mean the poor countries of West Africa that are ill-equipped for such an outbreak. First world country type people like ourselves really need not fret, because even if the virus did jump on a plane, resources are readily available to quarantine and eradicate the spread.
But let us also drop some perspective on this whole situation. Ebola is a scary thing that gives people with a horrible death. But according to AP, the death toll is peanuts compared to the millions of lives that AIDS takes in Africa every year, as well as the hundreds of thousands of deaths attributed to pneumonia and malaria.
But those numbers don't dismiss the seriousness of the outbreak, as the World Health Organization has declared an international emergency. But this is something that will eventually be corralled and squashed as resources are put into place to halt the spread.
And one such resource could be set to hit the market in 2015. GlaxoSmithKline is a British pharmaceutical company that teamed up with scientists from the good old US of A, and they're knee-deep in the process of pumping out a preventative vaccine. After human tests are completed and results are analyticified, the hope is to fast-track this stuff to all the suffering communities. Jean-Marie Aquabel, head vaccine person at the WHO, said, "We are targeting September for the start of clinical trials, first in the United States and certainly in African countries, since that's where we have the cases."
So until then, the hope is to try and contain the spread as much as we can, which might be tough due to where the outbreak occurred. Dr. Keiji Fukuda from the World Health Organization says, "What is difficult in this situation is that we are dealing with countries with weak health systems, and we're dealing with areas in which practices like good infection prevention and control practices are not the norm in some of the hospitals and in families and communities."
Scary stuff.
Yep.
If you want to know more, please click on this annotation or the link in the description to watch our Everything You Need to Know About Ebola video. I'm William Haynes.
I'm Joe Beretta. Thanks for watching.